This is the thyroid cartilage, and it's the largest laryngeal cartilage which helps to protect the larynx and all the other structures within it. The only floating bone in the body is called the hyoid, and when the sternohyoid is contracted, it pulls down on this bone. This is the cricoid cartilage, and when you're palpating the area that this cartilage resides, you'll be able to feel the anterior arch which protrudes further than the rest of it. The arytenoid cartilage, seen here in magenta, is composed of hyaline, just like the cricoid cartilage. The corniculate cartilages attach themselves to the apex of the arytenoid cartilages, where the area epiglottic fold inserts. This white structure is the epiglottis and is what covers your trachea when you swallow. The vocalis, seen here in dark blue, is comprised of fibers from the Thyrornoid Muscle. The trachea, which I have in gray, is made up of C-shaped cartilages and may also be referred to as your windpipe. Before moving on to the muscles, I'd like to note that the intrinsic laryngeal muscles are innervated by cranial nerve 10 from either the recurrent laryngeal nerve for the thyroarytenoid, the PCA, LCA, and arytenoid, or the superior laryngeal nerve for the cricothyroid. Posterior cricoarytenoid muscle, or PCA, is located on the back surface of the cricoid cartilage and is shaped like a fan. Its origin is on the cricoid lamina and goes upwards and towards the side, exhibiting a converging pattern which then inserts on the back upper surface of the muscular process of the arytenoid cartilage. This muscle uses a rocking motion to move the arytenoid cartilage away from the midline. The muscle fibers that are located laterally within the PCA do a bulk of the work. These fibers insert on the upper surface of the muscular process, and when they contract, they slide the arytenoid cartilage up and back along the sloping rim of the cricoid cartilage. Fibers located in the medial part of the PCA insert upon the back surface of the muscular process and contract to stabilize the arytenoid cartilage against forward-directed forces. This muscle is also a primary abductor for moving the vocal folds when it shortens and will lengthen the vocal folds when it contracts. The lateral cricoarytenoid muscle, or LCA, which is a little trickier to see as it is inside the tube in a peach color, sits about right here, and it originates from the upper rim of the cricoid cartilage. Its fibers insert on the muscular process and front surface of the arytenoid cartilage by extending up and back. In order to rock the arytenoid cartilage towards the midline, the LCA must contract. When the LCA is activated, it may slide the arytenoid cartilage forward and towards the side, along the downward sloping path of the long axis of the cricoid facet of the cricoarytenoid joint. The LCA adducts the membranous interior 2/3 front portion of the vocal folds, which shortens them and controls the squeeze or force of contact. The action of the LCA pulls forward on the muscular process of the arytenoid cartilages, which rocks them over the cricoid cartilage and swings the vocal folds down and in. Medial compression of the LCA can also decrease the effective mass of the vibrating portions of the vocal folds, which will then increase fundamental frequency. The interrenoid muscle has two parts, which are the transverse arytenoid, seen here in blue, and the oblique arytenoid, which is in pink. The transverse arytenoid originates on the back surface of one arytenoid and inserts at the same location on the other arytenoid, while the oblique arytenoid's origin is on the side back surface as well as the muscular process of the arytenoid and inserts in the apex of the opposing arytenoid. When the transverse arytenoid contracts, it will adduct or pull together the arytenoid cartilages due to an upward, inward, and backward sliding movement along the long axis of each cricoarytenoid joint. When the oblique arytenoid contracts, it will adduct or pull together the arytenoid cartilages by way of tipping action. The Thyrornoid Muscle, seen here in bright pink, forms the majority of each vocal fold and originates from the internal surface of the thyroid lamina and inserts on the ipsilateral arytenoid cartilage. When the longitudinal fibers are contracted, the distance between the thyroid and arytenoid cartilages is reduced and pulls the two ends of the vocal folds together towards the center lengthwise. This will also cause a forward pull on the arytenoid cartilage, which will then rock it towards midline. The contraction will also shorten the vocal folds as well as their internal fibers. Isometric or eccentric contractions of this muscle in conjunction with other intrinsic muscle openings will increase the internal tension. When the vertical fibers contract near the sidewall of the larynx, the position and configuration of the corresponding ventricular folds may be affected. This muscle's activations are also control variations of fundamental frequency in conjunction with the cricothyroid. The cricothyroid muscle originates from the outer front and side of the anterior arch of the cricoid cartilage and inserts on the outer front and side of the lower border of the lamina and inferior cornu of the thyroid cartilage. When contracted, it will increase the distance between the thyroid and arytenoid cartilages, as well as decrease the distance between the upper border of the cricoid cartilage and the lower border of the thyroid cartilage located at the front of the larynx. This occurs due to a rotation of the thyroid cartilage on the cricoid cartilage and/or a rotation of the cricoid cartilage on the thyroid cartilage. Activation of both the pars rectus and pars oblique, which are both components of the cricothyroid muscle, cause this rotation. The pars oblique can also increase the distance between the thyroid and arytenoid cartilages thanks to forward sliding of the thyroid cartilage and/or backward sliding of the cricoid cartilage. This muscle is also responsible for lengthening the vocal folds in a forward direction as well as stiffening it.